Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? From r/Ask Reddit. Part 3. Former vet tech. Had a woman scream at me and my vet for telling her it's the law to have your dog vaccinated against rabies. She said the rabies vaccine causes autism in dogs and makes puppies stupid. Side note, 3 weeks later her puppy died of parvo. She got another one immediately after and did not clean her home. 2 more died in the following months. Animal control and the city had to get involved. Once had a guy come into the emergency room because he snorted a random white powder found in a plastic bag left on a random bench in the middle of a sketchy park and started feeling suicidal. I am a dermatologist in India. As is the culture here, people eat with their hands, and almost all of our curries or even other dry side dishes have a lot of turmeric. It is common knowledge to anyone born and brought up in India that this means the nails of your dominant hand, statistically the right hand, are going to be yellow stained. Because we have seen this happen since our childhood. Usually this wears off in about a day and a half if you wash it a couple of times. Cut to the first patient in my OPD. A young girl in her early 20s, very anxious. Me, what brings you here today? P. Doc. My right hand fingernails keep getting yellow discolored. Me, only right hand. P. Yes. And only after meals. Me, do you eat with your hands? P. Yes. Always. Me, so, you know it's just turmeric, right? P. Yes, but can you make it stop happening? Me, for God's sake. Use a spoon. P. So you mean there is no medicine to make it stop? Me, no. This might hit home more with people of South Asian cultures or people who habitually eat turmeric cooked food with their hands. Anyway, for a grown-ass person to complain of this was just surprising and a little ridiculous. Go see patient in labor. Explain through the whole risks/benefits and process of a labor epidural. Finish up procedure and have just secured the epidural catheter to the skin. Husband asks how is she supposed to pee through that small a catheter. My aunt. She was diagnosed with cancer. Instead of getting treatment, she went hardcore vegan and prayed, refused to use any med. Doctor said she could have made it for few more years. She died after 6 months. I worked EMS for years. It never ceased to amaze me the things people will do to themselves or others for fun. Confronted with these types, my first question was always, at what point did this seem like a good idea? The weirdest one I can remember was a guy that put his P*NIS through a large metal nut. Once he got erect he couldn't get it off. Pharmacist. Don't even know where I would begin for some of the ridiculous situations I have had. Up there however has to be whenever I had a lady swallow a full box of suppositories and came in to complain that the issue has not cleared up and the medication tasted bad and was hard to swallow. Do sometimes wonder how people put one foot in front of the other. My brother did a rotation in an ER before med school. Paramedics brought in a man with a lacerated neck. He was drunk and fell into a fish tank. His drunk buddies called 911. When the paramedics arrived they realized his drunk friends had put a very tight tourniquet around his neck to stop the bleeding. Edit, I texted my brother to remind him about it. It happened almost 20 years ago. Apparently it was worse than I remembered. The guy and his buddies were doing drunk WWE. He had a 2-inch glass shard stuck in his head. In addition to the neck laceration, dude came into the ER with no idea the glass was there. 4 different firefighters had to hold him down as he screamed sexist remarks at the female doctor. He said when they removed the glass, blood shot about 10 feet in the air. My brother at that point silently noped the H*LL out of medicine. He went on to attend Berkeley Music School and is living his best life as a musical producer and engineer. And is not arguing with rednecks about whether or not there is a glass shard in their head. Okay, so not a medical professional, but hear me out for a second. I work in a gym and recently had a client come in for an induction, basically walk through the gym design program based on goals, needs, and physical capacity. The client, in her late 70s, has a shoulder injury, which the physiotherapist has said the rotator cuff is barely attached. Client has been suffering in severe pain for years and hasn't been able to use that shoulder. And refuses to go to the doctor as she doesn't want to see a surgeon. Doesn't want surgery. I've echoed what the physiotherapist has said and have refused to do any upper body exercises because of how bad the injury is. The client would rather live in severe pain than seek necessary medical treatment and only takes pain relief medication when the pain is intolerable. My wife was in a meeting with a doctor who had a patient argue that she does eat vegetables because she always has ketchup on her cheeseburgers. Pregnant, smoking crack on a public sidewalk and twists her ankle. Decides to call the police for help and then continues to smoke crack as they arrive. Police then promptly arrest her, and she becomes my patient. I'm not a medic but an environmental health officer that investigates infectious disease, sources, causes, exposure. I had a case in a 2-month-old of Campylobacter, food/waterborne poisoning. The mother called me and asked how could she get it when it comes from chicken and she's vegan. When I say vegan, the mother meant they were treating the baby as vegan. No breastfeeding or milk substitute. Proper boiled my piss that one. Edit, by milk substitute I meant breast milk substitute as in formula to make that clear. EMS checking in. Late 20s male called 911 for a mild headache, no alarming symptoms. Middle of allergy season. Being good medics we check all the things, totally normal vitals. No fever, no medical history. Just a mild headache that started about 30 minutes prior. Do he take Tylenol or ibuprofen or anything? Nope. He wanted to go to the ER to let the doctors handle it. Imagine the bills. Nurse here. Had a patient with a tibial plateau fracture, that demanded to see the doctor because she wanted to quit her antithrombotic medication. Bad idea. According to her it gave her a dry mouth. I explained to her that it was no known side effect of that drug. This lady had type 2 diabetes and administered her own insulin. Dry mouth is a side effect of high blood sugar. Tested her blood sugar, it was too high. Turns out she was using the same needle twice. Edit, these particular needles are single use, so she only got half the dose. I worked in cancer research/surgery a couple years ago. There is a good amount of people who will refuse to have a small removal/surgery because they think holistic medicine or praying it away will work. They always come back and we always have to remove so much more. One time a patient had a melanoma on their calf and the doctor wanted to do a simple wide excision. But they left because they wanted to pray it away. Came back a couple months later because it got bigger and we had to amputate their leg. Pretty sure they had positive lymph nodes at that point too. Literally yesterday. Consumed 8 cans of Red Bull in a 2-hour time frame. Presented with palpitations and severe chest pain. Please like, subscribe, and leave a comment if you enjoyed. Keep the thread going in the comments section down below.